everyone. Today, let's begin this story in a slightly different way. There was an American man who went to the emergency room with flu symptoms. He received a bill close to $3 million, about $2,200. He stood in the hallway, pale, unable to speak, thinking, if I get sick again, how am I supposed to survive? Months later, he visited Korea. With similar symptoms, he went to a hospital again. This time, after treatment, the amount he paid was 60,000 won, about $45. As he walked out, he said, in this country, the hospital bill didn't attack me. This is where today's story begins. How Korea's healthcare system became a structure that changes people's lives around the world. Korea's healthcare cannot be explained simply by saying it is cheap, fast, or high-tech. Korean healthcare is a philosophy, a structure that answers, how does a nation protect its people? Most Koreans don't realize how privileged their medical environment is. It feels too normal. Foreigners see it differently. After treatment in Korea, they say, being sick in Korea wasn't the problem. Leaving Korea, and losing the comfort of not fearing medical bills, that was painful. This sentence shows the emotional and social value of Korean healthcare. The shock is not the price, but the structure. When foreigners first learn about Korean healthcare, they aren't just surprised by low prices, they are shocked by how such prices are possible. In the U.S., you receive treatment only if you can afford it. In Korea, treatment is considered a right for everyone. This is a system difference, not a price difference. In America, private insurance pushes prices sky high. In Korea, the national insurance system manages and stabilizes medical costs. Foreigners say, these prices are impossible without government support. A foreigner who had an MRI, 2 specialist consults, blood tests, and prescriptions, paid $120. His American friend said, this isn't a medical bill, this is a miracle. Foreigners also experience the speed. ER waiting time is just a few minutes. Tests are done on the same day. Results come on the same day or the next. Further tests and treatment are connected immediately. They say, in Korea, it's not the hospital that moves, the system moves. A Canadian wrote, in Korea, hospitals are not destinations, they are part of the everyday scenery. Foreigners experience health screenings, endoscopy, CT, ultrasound, blood tests, all in one day. They say, Korea isn't just managing health, Korea is protecting the future early. Foreigners ask, how much do Koreans pay to receive this level of service? And when they hear the numbers, employees pay about $150 a month, with half paid by the company. Out-of-pocket costs are around 20%. Even non-covered tests are far cheaper than abroad. Americans react, what Koreans pay in a year is less than what I pay in 1 month. They add, in Korea, I never met someone without insurance. In America, I know too many. In many countries, going to the hospital means asking, should I go? How much will it cost? Will insurance cover it? What if it doesn't? These questions make people sick before the illness does. In Korea, you go to the hospital, get treated, and go home. Foreigners say, for the first time in my life, I wasn't afraid to be sick. Korea is not cheap healthcare, it is high-quality healthcare that happens to be affordable. Major Korean hospitals Asan, Samsung, Severance, Seoul Street, Mary's, are recognized globally. In radiology, imaging, cancer care, ICU treatment, Korea often outperforms the U.S. and Europe. A European specialist said, Korea combines high-end equipment, expert staff, and extremely fast access. Almost no country has this combination. A father from the Middle East was quoted $500,000 in the U.S. for his daughter's heart surgery. In Korea, the surgery cost under $30,000, and succeeded. He said, Korea didn't just give us healthcare, Korea gave us life again. Foreigners see clearly what many Koreans overlook. They say, in Korea, hospitals are not a destination, they exist inside everyday life. Clinics, pharmacies, specialists are within 5 minutes almost anywhere. This is not coincidence, but national design. Inside Korean hospitals, they see self-check-in kiosks, mobile reservation and payment, automated test routing, robots delivering medication, and linked electronic medical records. Foreigners say, this isn't a hospital, it feels like a city, where healthcare flows automatically. Within days, they experience 3 minutes to check in, seeing a specialist immediately, tests done the same day, results the same or next day, and the bill far lower than expected. Yes, there are challenges: short consultation times, overworked medical staff, low reimbursement rates, and occasional debates about overtreatment. But despite these issues, Korea's overall accessibility and efficiency remain world-class. On Reddit, foreigners post receipts. ER flu treatment 60,001. Thousands of comments. Impossible in America. Is this Photoshop? Korea runs on a different system. One foreigner said, "In Korea, when you leave the hospital, you only worry about your symptoms, not your bill." Foreign media say, Korean healthcare is national innovation. American media add, Korea's single-payer system maximizes national efficiency. European media say, Korea is one of the only countries providing high-quality care at low cost. They describe health screenings as, Korea has industrialized the concept of checkups. Foreign patients remember their experience like this. In Korea, it felt like someone else was saving my waiting time. One sentence from the doctor made me feel safe. In this country, being sick didn't feel like a burden. And the most loved comment, Korea didn't prescribe medicine, Korea prescribed peace of mind. With K-Aura, the world becomes not just news, but structure. What do you think? Feel free to leave a comment.